Welcome to our group presentation. This presentation will discuss COVID-19 and the lessons that the physiotherapy profession should build upon. Firstly, it is important to give background into the severity of COVID-19 and also the implications that this condition caused worldwide. So what is COVID-19? Coronavirus, or more commonly known as COVID-19, initially presented in Wuhan City, China on the 31st of January 2019, and it can be described as a pneumonia of an unknown etiology. This highly contagious condition was transmitted via respiratory secretions. This included cough and nasal droplets. And those who had had contact with contaminated surfaces were infected via touching their mouth, nose, and eyes. Some symptoms of COVID-19 included a continuous cough, headaches, chills, and also difficulties with breathing. The World Health Organization declared a global pandemic on the 11th of March 2020. This resulted in lockdowns worldwide, and subsequently a national lockdown was commenced on the 16th of March 2020 by the UK Prime Minister Boris Johnson. It is important to note that 80% of cases were mildly affected by COVID-19. However, 20% did develop severe infections, and within that, 5% required ventilatory support. To understand entirely the severity and disruption of this condition, it is notably important to look at the prevalence worldwide. There was over 270 million confirmed cases, and with that, over 5 million deaths worldwide by December 2021. Due to the detrimental impacts of COVID-19, it is no surprise that the healthcare system suffered immensely. The pandemic stretched the healthcare system and highlighted the already failing NHS. This was due to staff shortages, underinvestment, capacity restraints, and growing waiting lists that were already an issue prior to COVID-19. As highlighted by the British Medical Association, extraordinary efforts were required from healthcare staff due to a healthcare system that was already in a scarcity state. Physiotherapy played a key role in the management of COVID-19, offering cardiorespiratory support, rehabilitation interventions, and ventilatory support with critically ill patients. Physiotherapists continue to play pivotal roles within COVID management, including long COVID rehabilitation clinics. Whilst the COVID-19 effects no longer appear to be as detrimental, there can be lessons learned from how COVID-19 was handled by the health service. This aids for future opportunity.
The BMA COVID review claim a healthier population is a more resilient one, showing that the UK was on the back foot before the pandemic, ranking fourth highest in number of obese adults. Throughout all of society, a proactive approach to health and safety was adopted with quotes like, "We all must do it to get through it," to facilitate the need for the whole societal input for infection prevention. Alongside a global effort to increase hand washing efficacy, all healthcare settings adopted personal protective equipment, with masks helping to reduce exposure by 50 to 75%. The NHS were effectively able to roll out a large-scale vaccination programme in a short period, being hailed as an unprecedented success, highlighting how beneficial the NHS is and emphasising the need for greater funding and resourcing. Looking forward, as we continue to aim for a healthy population to combat such a pandemic, physios must endeavour to encourage our population to meet the World Health Organization physical activity guidelines. Furthermore, we should continue to offer and engage with smoking cessation services to reduce the two most prominent and reducible risk factors for respiratory illnesses. As we continue to work amongst an ever-growing burden of illness, a proactive approach to health should at least limit the strain that's put upon our NHS. The Office for National Statistics have shown that 1.5 million people in the UK are still living with long COVID, and health professionals alike remain fairly unprepared for managing it. NHS lists problems like fatigue, shortness of breath, memory fog, palpitations or chest pain, joint pain and aches as symptoms of long COVID. While this presents as a relatively new disease, many of these have been managed by physiotherapists for a long time. Regarding respiratory symptoms, the CSP recommended treatment of education and breathing retraining using ACBT and associated techniques like diaphragmatic breathing, similar to the treatment of COPD and asthma. As a profession, it's important that we establish specialised treatment protocols for diseases like long COVID and not stopping there but continuing to manage other post-viral symptoms. This would help to guide physios as we continue to treat patients in this new category. This will help to prevent any further acute hospitalisation of long COVID sufferers, and as with all clinical complaints, Specific outcome measures and multidisciplinary team collaboration will help to further this practice. This, however, cannot be done without the appropriate research being carried out to support the new patient population, and in the meantime, continual education and individual management should be prioritised to achieve patient-set goals and aid their recovery from this debilitating disease, and maintain quality of all aspects of the profession, regardless of specialisation. COVID hung over the placements of many physiotherapy students who were faced with many challenges as they put their skills into practice. With Hagigi finding students felt that they benefit from the experience and develop resilience on the steep yet positive learning curve. As many services came to a standstill, research was also impacted. The CSP took initiative and commissioned research into a remote physio consultation. They found that it was safe, feasible, and acceptable for those who accessed it. In practice, it should be combined with in-person consultations based on patients' need or preferences for the best effectiveness. And as the novelty of COVID resulted in little being known about its impact, academics flocked to assess its qualities, and by June 2020, over 23,000 papers had been published. Furthermore, virology research rose from 2% to 10 to 20% of all biomedical research. Most non-essential and non-COVID clinical research was suspended due to difficulties and transmission risks. This caused a reduction in recruitment of research subjects and delay of data entry into clinical databases. Learning from COVID, physiotherapists should continue to stay up to date with evidence to enhance the profession's adaptability to new problems. Building on the foundation of long COVID, joint efforts from all physiotherapy departments like MSK and cardiorespiratory can be utilised to create new evidence-based protocols. This, as well as further MDT participation in studies, can be used to examine the holistic management of patient conditions.
So during the pandemic, it underscored the importance of multidisciplinary care. Physiotherapists collaborated closely with doctors, nurses, and other healthcare professionals as well. They all address complex patient needs through teamwork and specialised expertise. This gives them the opportunity in the future to promote holistic, patient-centred care using the biopsychosocial model. This puts focus on physical, psychological, and emotional aspects of health. It can strengthen interdisciplinary collaboration to achieve better long-term patient outcomes. Physiotherapists were crucial during the pandemic, especially in units such as the ICU. They provided respiratory support, including pronin and CPAP. They delivered rehabilitation and mobilisation to improve lung function and reduce deconditioning. This all facilitated quicker and safer patient discharge from the hospital so that they were able to return home and not be at risk of any infections from the hospital as well. So for future opportunities, this gives healthcare professionals a chance to expand training in ICU management and respiratory care, develop skills to manage both acute and chronic conditions, and enhance preparedness for future pandemics and critical care scenarios. Telehealth became essential during the pandemic. It enabled physiotherapists and many other healthcare providers to provide remote consultations and treatments. They done this through the use of video calls and digital platforms when in-care person was not available. So for future opportunities, we can incorporate telehealth into routine practice to reach remote or underserved populations, implement hybrid care models combining in-person and telehealth sessions, improve access, reduce waiting times, and enhance overall patient outcomes.
Advocacy and professional recognition, so lessons learned. The physio workforce played an essential role throughout COVID-19 in treating and caring for patients. Staff shortages have been found though and urgently need addressed, as an increase of 7% of the workforce is needed each year to keep up with the demand. The increase in waiting times and closure of services due to the lack of emergency and crisis preparedness at local and national levels has been shown. Some of the future opportunities to address these things are lobbying for new jobs, increased intake in universities, and educational innovation, such as North East Hartlepool's Trust physio team. They released an initiative which enhanced student placement experiences, increased the number of available placements by 300%, but more research is needed. And the UK Health Security Agency strategy for preparing, respond to, and recovering from health security incidents of varying natures. Mental health during COVID. So some of the lessons learned during infectious disease outbreaks, the psychological response heavily impacts the spread of the disease, the emotional distress and the social disruption. The mental health consequences of COVID-19 are likely to be present for longer and peak later than the pandemic itself. It's found that mental health of significant numbers of healthcare professionals have been compromised during the pandemic while still having to work. And it's also found that in Northern Ireland that there's a severe lack of data surrounding mental health. So some of the future opportunities, physios emphasise the mind-body connection, promote holistic care and support behavioural change. They do this by embracing biopsychosocial and interdisciplinary approaches with exercise proven to alleviate mental health symptoms. Mindfulness-based interventions for HCPs to help enhance stress management, mindfulness and mental well-being during critical health crisis, and the development of Northern Ireland's mental health outcomes framework to address the lack of data has been done as well. Community and outpatient rehab. So the lessons learned. The pandemic presented challenges and opportunities, prompting calls for the profession to adapt better to address infectious diseases and long-term conditions in general. The lack of appropriate rehab given to discharged COVID patients was due to the absence of agreed rehab pathways, unclear definitions of essential rehab, and insufficient local and national planning as well as funding. Future opportunities. The pandemic offers a unique opportunity to review and redesign services, emphasising personalised care and long-term self-management. It has to be grounded in behavioural science and adherence to strict research, and should involve evidence review, user engagement, service evaluation and staff wellbeing to shape the new standard for outpatient physio. And telehealth and the implementation of hybrid models, as previously mentioned, as ways to reduce waiting times, improve access and increase the reach of services.
Whilst physiotherapy practice has gained lessons during the COVID-19 pandemic, these lessons and their plausibility for future utility are critically analysed in current research. Now, regarding telehealth and digital care, we heard earlier how these provide advantages in terms of reducing waiting lists and addressing patient access in a time-efficient manner. Now, Bucklow 2021 study reveals that healthcare practitioners adopted these technologies to manage the spread of COVID-19, and this also allowed for greater access to patients when COVID lockdowns were in place. Now, whilst these lessons could be utilised to address waiting times in the future, it is important to acknowledge that there were limitations to this study. Now, this study was limited due to short research time employed. However, it does display positive groundings for the use of these technologies in the future. Regarding the role of physiotherapists in critical care environment, Trojan et al. 2022 and Acer et al. 2021 both identified that the pandemic actually evolved the role of physiotherapy within the ICU setting and therefore reduced ICU length of stay and also treatment costs. However, it's important to highlight that both research is limited by sample size and poor response from participants involved. Now, one of the most significant roles the physiotherapy profession has learnt is their role in managing long-term COVID. Now, Sanchez Garcia et al. 2023 demonstrates that physiotherapy is a vital component of the treatment strategy for people with long-term COVID. Now, therefore, this provides clear lessons that physiotherapy can use this role moving forward to provide effective patient-centred care for its patients. Another area that physiotherapy could build upon in the future following the COVID-19 pandemic is in relation to training and development. Now, this area has been vastly researched. McDonald et al. 2020 highlights a sudden shift in education to online learning and the development of new modes of student instructions using video-based assessments and virtual case instructions. Now, however, despite limitations regarding sample size, it has been argued that these new modes of online learning and CPD courses being moved to online also may provide future opportunities for the deployment of education and training. Rawlinson and Connell 2023 highlights the new outpatient opportunities that the COVID-19 pandemic provides to the physiotherapy profession. There is now a recognition of the increasing role physiotherapy has in the community and how effective that this role has been during the pandemic. Now, a critical evaluation in this area highlights the need for future research while acknowledging the ever-increasing and pivotal role that physiotherapy can now develop in the future. Whilst it is important for us to critically evaluate the existing evidence on the lessons COVID-19 has had on the physiotherapy profession, it is equally important for us to analyse the methodological weaknesses of the current research to date. Now, these do include the lack of gold standard randomised control trials, small sample sizes and studies not performed within the United Kingdom, therefore highlighting the need for future research. Now, however, despite these limitations, we can conclude that there are positive lessons that physiotherapy practice may build upon, including the use of telehealth and digital care, training and development, the advocacy of physiotherapy role within the critical care setting, and the significant role in long-term COVID management. Also, the greater consideration of the biopsychosocial model when treating patients, and we must also consider the expansion of the physiotherapist's role in community-based rehabilitation. Now, as healthcare professionals, it is important for us to reflect upon clinical implications of COVID-19 on the physiotherapy practice and focus on these lessons to help provide effective healthcare for our patients. Now, therefore, apart from the theoretical lessons learned, COVID-19 has taught us resilience, innovation and collaboration, therefore empowering the physiotherapy profession to evolve their role within healthcare. The following slides contain references that we have used throughout this presentation. Thank you.